Let's go over the 3-question warm-up for Foundations 8. First question. What protein is involved in transporting an endocytosed vesicle from the plasma membrane to the endosome? Remember this image. Here you can see the clathrin coat endocytosing the vesicle, and then the uncoating. So the protein involved in transporting an endocytosed vesicle from the plasma membrane to the endosome is clathrin. Next, which metals are known to facilitate the generation of oxygen-free radicals? Iron and copper. Next, which tumor suppressor proteins prevent the progression of the cell into S phase? And by now you should be familiar with this image. The progression from G1 to S phase can be prevented by RB and P53. That's it for our warm-up. Now I'm going to hand it over to Dr. McInnes for the lecture.
In the video on inflammation, I briefly mentioned that during the remodeling and rebuilding of tissue that goes on following an injury, your body starts laying down extracellular matrix proteins that form scars and such. So let's talk a little bit more about this extracellular environment, starting with collagen. Collagen is the most abundant protein in our bodies, and it's what provides structure and order and substance to our extracellular space. There are 4 main types of collagen you need to know about. There are actually more than a dozen different types of collagen, but these are the 4 that are most important to know about. Type 1 collagen is your strong collagen. So we find it in strong structural tissues like the skin and bones, and also the dentin of your teeth and so on. So type 1 is strong, think bone. Also wound repair like scar tissue. Scar tissue is tough and strong, really strengthen that healed wound. Then type 2 collagen is your slippery collagen. So it's found in slippery tissues like cartilage and the vitreous body of the eye, and also in the nucleus pulposus in your intervertebral discs. Type 3 collagen is your bloody collagen. So it's found in bloody tissues like the blood vessels. It's also found in the skin, which is highly vascular, and also in the uterus and fetal tissue. We also see type 3 collagen in granulation tissue. Remember, granulation tissue is beefy red and shiny and wet and kind of bloody looking. And then type 4 collagen is found in the basement membrane. So again, type 1 is strong, type 2 is slippery, type 3 is bloody, and type 4 is the basement membrane. So there's a really awful, disgusting mnemonic for this, which is to think about a strong, slippery, bloody BM. You know, BM for bowel movement, but here BM stands for basement membrane. So a strong, slippery, bloody BM. Now let's break for lunch. So now that we know where we find these types of collagen, how do we make collagen? Well, the synthesis, and especially the modification of collagen, is about a 3-star topic. About half of you will have a question asking you to identify what's going on with post-translational modification of collagen. So here are the 6 main steps. First, the basic peptide is synthesized in the rough ER of fibroblasts. So what are fibroblasts? They're the cells that create scars and fibrous tissue and collagen. So they translate the mRNA and synthesize a polypeptide called pre-pro-collagen. Lots of proteins are synthesized as propeptides, and then they're cleaved or modified to become the final protein. But this is actually first synthesized as a pre-pro-collagen. This is going to become the alpha chain of the collagen. These alpha chains have a very unique structure. You either have glycine, proline, X, where X is any other amino acid, or you have glycine X hydroxyproline. Now there can be more than 1,000 amino acids in a row, so these are really long peptides. So that's the first step, synthesis of pre-pro-collagen alpha chains. The next step is hydroxylation of lysine and proline residues. This is the step that requires vitamin C. So if you don't have vitamin C, you can't hydroxylate collagen, and basically you stop right there. If you can't make collagen, you end up with scurvy.
Scurvy. Nasty little thing.
This is why vitamin C is important in the prevention of scurvy, because it's so critical in making collagen. This is also the reason we said vitamin C is important for wound healing. You probably remember how sailors would get scurvy because they were stuck on a boat for months and months without any fresh fruits and vegetables to eat, so they would be vitamin C deficient. So once they figured out to bring along some lime juice, make sure everybody got a little ration of lime juice every day, they could prevent scurvy. The third step of collagen synthesis, still inside the fibroblast cells, is glycosylation of the hydroxylated lysine residues. And then you add some hydrogen bonds and some disulfide bonds, and at this point you've gone from that pre-pro-collagen to pro-collagen. And here we start to see the structure of collagen taking place, which is a triple helix of 3 alpha chains. The fourth step is exocytosis. So at this point you've done as much as you can inside the cell. But collagen is a huge molecule, so you can't assemble it completely inside the cell. In order to finish the processing for collagen, you have to export the procollagen and finish constructing your collagen outside the fibroblasts. The next step then is to process the procollagen into something called tropocollagen. So basically you cleave the terminal regions of procollagen and then you have tropocollagen. That's proteolysis, cleavage of proteins. And then finally you cross-link a bunch of these tropocollagen molecules together to make these enormous collagen fibrils. So this is a covalent bond, a covalent cross-link between lysine on one alpha chain and hydroxylysine on the other. So you do all these cross-links, then you've got your collagen. One thing I want to just mention in passing while we're talking about collagen and wound healing and scar formation, what do we call a scar where there's too much collagen deposition? This is a keloid. A keloid is a scar with too much collagen deposition. And one way we can treat keloids is by injecting the keloid with glucocorticoids because steroids inhibit collagen synthesis. And that's something worth knowing. Next, let's talk about 3 diseases of defective collagen synthesis. First, osteogenesis imperfecta, then we'll touch on Ehlers-Danlos syndrome and Alport syndrome. So osteogenesis imperfecta, or OI, is a bone disease where you have fragile bones. You can guess from the name that you have imperfect genesis of bones. Osteo is bone, so osteogenesis imperfecta. There are a whole bunch of different subtypes of OI, but the most common type is OI type 1, which is an autosomal dominant disease where you have normal type 1 collagen but not enough of it. Or in some cases you might have slightly abnormal type 1 collagen. Either one of those can occur. But remember, type 1 is your strong collagen. It's found in your bone. So if you don't have it, you're going to have multiple fractures, even with minor trauma. And then you can have leg and arm deformities as a result. I mean, kids are always falling down and running into things. So these kids are always breaking bones. They might develop bowing of the long bones in utero, which you see here. They can also have blue sclerae because that sclera is deficient in collagen. So it's going to be thinner and somewhat translucent. You're able to see the choroid right through the sclera. And that gives the sclera kind of a bluish color. That's usually a dead giveaway. If they give you a picture of a patient with blue sclerae, they're giving you the diagnosis of OI type 1. Or they might give you a pediatric x-ray with tons of fractures in various stages of healing. You're either going to think about OI or you might want to think about child abuse. Now, don't mistake one for the other and ship the kid off to CPS for foster care. It could be a case of OI, so look for those blue eyes. You might also look for hearing loss because ossicles of the middle ear can be affected. And you can also look for dental abnormalities because that type 1 collagen is found in the dentin of the teeth as well. Then on the other end of the OI spectrum is type 2 OI, which is autosomal recessive, and it's so severe that these kids die in utero or maybe within the first couple of days after birth. So it's sometimes called perinatal lethal OI. So type 1 is much milder than type 2 by comparison. Next, let's talk about Ehlers-Danlos syndrome, or EDS, which is another kind of collagen defect. Again, there are a bunch of different subtypes of EDS, and review books have been getting this wrong for ages, so let's break it down and try and get it straight. There's classical EDS, which affects mainly type 5 collagen, and also type 1 collagen to a certain extent. So in classical EDS, you have hyperextensible skin and joint hypermobility. Now, hyperextensible skin is where you pinch the skin, and instead of stretching a little bit like this, it's going to stretch a lot like that. And then joint hypermobility means they can bend their joints in all sorts of freaky directions, like bending the finger all the way back to scratch their wrist. Now, 100 years ago, some of these individuals with classical Ehlers-Danlos were circus sideshow performers with names like the Elastic Skin Man. Another type of Ehlers-Danlos is called vascular EDS, which is due to a defect in the synthesis of type 3 collagen. Now, which one was that? Strong, slippery, bloody, BM. That was the bloody type, type 3 collagen. So type 3 collagen is going to be found in the blood vessels. So again, this is vascular Ehlers-Danlos, and it causes arterial rupture and hemorrhages and easy bruising. You can also see intracranial baryaneurysms with Ehlers-Danlos. So again, blood vessel problems. Then the last collagen disease we're going to mention is Alport syndrome. Now, Alport syndrome is a genetic defect of type 4 collagen. Which one was that? It's our basement membrane, or BM. So you see type 4 collagen in the basement membrane of the kidneys. So Alport syndrome causes kidney disease and nephritis and kidney failure. We also have type 4 collagen in the basement membrane of the ears, so you can have hearing loss. So kidney disease plus deafness equals Alport syndrome. Then also sometimes you might see eye problems, especially cataracts, or something called lenticonus, where you have this thinning of the capsule around the lens because the basement membrane of the lens also has type 4 collagen. So if you remember the mnemonic for reactive arthritis, that was can't see, can't pee, can't climb a tree, you can change that around a little bit for Alport syndrome. So it becomes can't see, can't pee, can't hear high C. So eye problems, kidney disease, and deafness. So that's it for collagen. Now, what else is in the extracellular matrix? Well, there's an extracellular protein called elastin. Now, elastin isn't a strong protein like collagen, it's stretchy. Elastin sounds like elastic because it's a stretchy protein. So, what tissues need stretchy proteins to be able to stretch and expand? Well, blood vessels, especially arteries. The alveoli of the lungs have to expand and fill up with air. The larynx, and also the spine needs to be able to bend and stretch. So we have elastin in the ligamenta flava along the spine. So elastin has a lot of proline and glycine, whereas we said collagen is rich in proline and glycine, but also hydroxyproline, which is kind of unusual. And then elastin is non-hydroxylated, so that's another difference between strong collagen and stretchy elastin. Now structurally, instead of an alpha chain triple helix, we have these proteins called tropoelastins, and they're held together by a matrix of a glycoprotein called fibrillin. And fibrillin is also made by the fibroblast, just like collagen. And if you have a defect of fibrillin, that causes something called Marfan syndrome, and that's characterized by hyperelastic joints, similar to Ehlers-Danlos, and also problems with the heart valves and the aorta, like aortic dissection. Now, Marfan patients are also often very tall, and they have these really long arms and legs, and really long spidery fingers, which we call arachnodactyly. So these are the hands of a patient with Marfan syndrome, and you can see that the thumbs are so long that the entire distal phalanx sticks out when the patient makes a fist. This is called Steinberg's sign. And in this patient, you can see the long limbs and those long fingers again. And he has a chest wall deformity called pectus carinatum, where the sternum protrudes anteriorly, kind of like the sternum of a bird. And this is sometimes called pigeon chest. So again, Marfan syndrome is a defect of fibrillin, which makes it part of elastin. The enzyme that degrades elastin is called elastase. And there's an enzyme called alpha-1 antitrypsin that inhibits elastase. Now, this is clinically relevant as well. What happens if your alpha-1 antitrypsin is mutated and it doesn't work properly so that it can't inhibit elastase? Well, that's a condition called alpha-1 antitrypsin deficiency. So the elastase is uninhibited and it goes around breaking down elastin left and right, out of control. As a consequence, you're going to get destruction of elastin in the alveoli, which results in emphysema, which is a pan-acinar emphysema. So if you see emphysema in a non-smoker, think about alpha-1 antitrypsin deficiency, especially a young non-smoker. Then the other clinical scenario resulting from alpha-1 antitrypsin deficiency is that the defective alpha-1 antitrypsin molecule can accumulate and polymerize inside the hepatocytes and lead to liver problems like hepatitis, cirrhosis, and even hepatocellular carcinoma. So that's it for collagen and elastin. Next, we're going to get into wound healing, but first I want to briefly talk about a topic that's not found in most review books that's related to wound healing, and that's the different mechanisms of angiogenesis, or neovascularization. So if you want to regenerate tissue and heal a wound, you need some blood supply, right? So there are a couple of interesting ways that this can occur. One way is that you can grow a new vessel branch off of an existing vessel. So basically, to do this, you need those metalloproteases that I mentioned in the last video, those zinc-containing enzymes that are so important in remodeling and reorganizing the extracellular matrix. These metalloproteases can kind of degrade and soften the basement membrane of the existing vessel. And then growth factors like VEGF, which is vascular endothelial growth factor, VEGF comes along and causes the vascular endothelium to proliferate and migrate toward the area that needs a new vessel. Then you have other signals that recruit supportive cells and lay down basement membrane for this new vessel. The other way to grow new vessels is that VEGF can also recruit endothelial precursor cells or endothelial progenitor cells to come out of the bone marrow where they kind of normally hang out. So they come out of the marrow and they migrate to where they're needed, and then they can grow new vessels that connect up to the existing vascular bed. And when we get to oncology, we're going to talk about how cancer cells that produce a lot of VEGF can induce your body to grow new blood vessels to feed the cancer. And that by inhibiting angiogenesis, we can fight back and prevent the cancer from being able to grow and spread. So now that we know about how to make collagen, we know how to make new blood vessels, we can talk about how to heal a wound. I'm actually going to cover this primarily in your study guide number 4. So for the first few hours after you're wounded, you're going to have hemorrhage and clotting. Maybe small microscopic bleeding, but those ruptured wounded vessels are going to leak and bleed, right? Then over the course of the first 24 hours, there's going to be acute inflammation. We said that the cells that mediate acute inflammation are primarily the neutrophils. And of course, those chemotactic factors are going to come into play here to flag down the neutrophils, make sure they get to the right place. Then on days 1 to 3, you have 3 overlapping things going on. The neutrophils are being replaced by macrophages, which clean things up and clear out cellular debris. You have granulation tissue being formed with fibroblasts coming in and laying down collagen, and then vascular endothelial cells coming in to reestablish the blood supply. What type of collagen did we say was involved with granulation tissue? The bloody collagen, type 3. Then, once you have a nice bed of viable granulation tissue, epithelial cells can start to migrate in. And this is called epithelialization, mobilization of epithelial cells to repair a skin wound. This happens pretty early on, and it's clinically relevant because post-op bandages after surgery need to be kept on for at least 48 hours. So you're going to keep the bandage on for the first 48 hours so that epithelialization can take place. You don't want to injure that wound in any way or create sort of osmotic damage with water or soap to that wound in any way in that first 48 hours. So after 48 hours, you can clean the wound occasionally, but in the first 48 hours, you want to let the process of epithelialization take place. Then, over a period of months, you have more and more collagen being produced. So first it was type 3 collagen being produced in that granulation tissue. Now it's more type 1 collagen, that strong collagen that's involved with scarring. So that's pretty basic stuff, but it's a good foundation to have, and as we begin to build upon it. So let's pause and answer the end of session quiz. All right, let's go over these answers. First question, what findings are associated with Ehlers-Danlos syndrome? So we said with classical EDS, you're going to get hyperextensible skin and joint hypermobility. And then with vascular EDS, you get easy bleeding and bruising, you get arterial rupture and intracranial aneurysms. Next, what are the different types of collagen and where can they be found? So remember your strong, slippery, bloody BM. So type 1 is the strong type. It's found in skin, tendons, bones, and some in the organs as well. Type 2 is the slippery type, mainly found in cartilage and in the vitreous body and the nucleus pulposus. Type 3 is the bloody type, which is found in reticular fibers in the walls of the arteries, in the skin, in the uterus, and fetal tissue. And then type 4 is found in the basement membranes, or the basal lamina. Next, which amino acids are found in large concentrations in collagen? So in collagen, you're going to find lots of glycine and proline and hydroxyproline. And then in elastin, you're going to find lots of glycine and proline. And the last question, what's the role of vitamin C in collagen production? So vitamin C is important in the hydroxylation of lysine and proline. Got to know that. So if you lack vitamin C, like in a patient with scurvy, there's going to be a defect in collagen synthesis, and that results in poor wound healing, swollen gums, bleeding, and anemia.
It's scurvy.
All right, that's it for the quiz, but we have a couple of rapid-fire facts for you too. So hyperflexible joints, arachnodactyly, aortic dissection, and lens dislocation, that's Marfan syndrome. Remember, that's caused by that defect in fibrillin. And then hereditary nephritis, cataracts, and sensory neural hearing loss, that's Alport syndrome, which is due to that defect of type 4 collagen. Remember, can't see, can't pee, can't hear high C. And then also be sure you can recognize Ehlers-Danlos syndrome and recognize scurvy as well. We just went over both of those. It's very, very high yield. So that's it for the rapid fire facts. And that's the end of Foundations 8. See you next time. Hello there. Today we're painting a portrait of a sweet young lady with osteogenesis imperfecta. What's the classic facial feature of osteogenesis imperfecta? Right, it's the blue sclera, those beautiful blue sclera. So let's take our knife, and we're going to pick up some of our titanium white and mix in a little Prussian blue. Then we're going to get just a little roll of paint on our knife, and we'll go up here to our canvas and just fire it in there any old way. Any old way you want, just like that. There are lots of different kinds of osteogenesis imperfecta, but most commonly there's a mutation in the gene for the alpha chains of type 1 collagen. Or maybe sometimes there's a problem with hydroxylation, but usually it's a mutation in the alpha chains, an autosomal dominant mutation. Looky there. Isn't that beautiful? I think so. It's just that easy. Well, the little clock on the wall says we're just about out of time. God bless you, my friend.